Good afternoon, everyone. I'm Tom Lewis. We're live in the News 13 studios on 13 Now. We're going to talk about a very serious issue today regarding children's mental health. And in case you watched our newscast last night, you know that we did a two-part special report last night called Mental Break. It was about children in our school system here who are dealing with mental health issues. I'd like to introduce our guest. First, Jeff Stone, who is with the Emerald Coast Behavioural Hospital. He's the clinical director. And we have Brianna Villalobos, who is the inpatient child and adolescent therapist at Emerald Coast. Thank y'all both for being with us today. We really enjoy y'all coming in and sharing your expertise with us today.
Thanks for having us.
Thank you.
Excuse me. We're going to start off by bringing you part one of the piece that we aired last night. It is by Thomas Schultz, one of our reporters here at WMBB, and this is part one of his special report again called Mental Break.
District schools are suffering from depression, anxiety, and other mental health issues. Officials say many children have family issues. Elementary school students are worried about how their families will pay their bills.
We have washers and dryers in every elementary school. Now, why do you think we have washers and dryers in every elementary school? Because a lot of the kids don't have any way to get clean clothes.
Bay District School Superintendent Bill Husfeld says it's difficult to provide enough support for all students struggling with their mental health. 118 students have been Baker Acted this school year because they are suicidal, homicidal, or psychotic. Almost 1,300 students have been referred for mental health services this year.
And the challenges are real. There's more concern right now for our wellness of students, their mental wellness, than ever before.
Husfeld says the future looks bleak, and bills aren't the only source of trauma.
This area has been through a Category 5 hurricane, a pandemic, and more recently, we've had wildfires. So these kids have been through a lot of trauma, a lot of stress, and those are the things that we're dealing with on a day-to-day basis.
Second graders and younger have yet to have a school year that hasn't been disrupted by Hurricane Michael or COVID-19, but more help is on the way. Bay District Schools received $11.9 million in federal Restart grant funds for mental wellness. 35% of that money is being used for staffing, but Husfeld says staff members are still being overworked.
We don't have the resources, the time, or the energy to keep up with all the kids and what they're doing. That's got to be the parent responsibility.
Husfeld says kids bring problems from home, which develops into issues at school. He says some parents don't listen to school social workers who say their child needs help.
If your child was sitting in the corner and scratched their knee or fell down and hurt their knee, you'd want us to help your child. We're telling you your child's got a problem. They're sitting in a corner. We need to help them. You need to let us help them, and they don't want to because they don't understand the depth of mental wellness.
He says some parents, quote, don't understand the complexity of raising a child. School social workers say many teachers, rather than parents, refer students for counseling.
The teacher is with the student all day, every day, and really knows the student well. So that's where a lot of our referral sources come from.
In Bay County, Thomas Schultz, News 13, Panhandle Strong.
Jeff, Brianna, you've heard that. Does that sound familiar to y'all? Are you seeing a lot more increases in these type of problems for children that are in the school system?
I would definitely agree that, yeah, that is a very good reporting on that because it is very true. I think this area we've seen a lot of increase in Baker Acts and, the issues that the kids are dealing with. I mean, the hurricane, the pandemic, now fires, plus a lot of home issues, it's really difficult for them.
And I think with what the community has put together to try to address these issues, with the increase of the mobile response team, the school setting up their own mental health teams, sheriff department setting up their mental health teams, we've expanded our adolescent capacity in our own hospital. I think we're seeing a response to an issue that's been there. And we're just realizing that with everything that's gone on, all the stressors, it just continues to be something that's growing.
In your practices, what are you seeing? What kind of problems are these children coming in with?
I mean, it's a lot of depression. There's a lot of suicidal ideation, self-harming behaviors. We certainly see some kids that come in with homicidal thoughts. We're also going to have some psychosis or things of that nature. A lot of anxiety. It's just kind of a big range of things, but a lot of similar issues as well.
Maybe I'm just naive, maybe I'm old, but kids should be having fun and enjoying themselves. They shouldn't be dealing with these kind of problems. Why is this? Is our society changed to a point where we're putting more pressure on kids these days?
I think there is a large component to that. Kids have high expectations put on them, and I think what Ken Chisholm pointed out, they've had a lot of major changes over the last few years with the hurricanes, with pandemics, with wildfires. You've also got the increase of social media. You've got kids who now are experiencing 24-hour-a-day bullying. It's hard to escape it. You've got constant stimulation. You've got the constant need for immediate gratification in a lot of areas now. Kids are they're redlining a lot sooner than we would have expected. You've just got a lot of kids struggling with a lot of variety of things. I don't think there's any one component to it. I think it's a culmination of everything that they're dealing with right now.
No, it's been this way, as you said, since the hurricane, really for the last 3 or 4 years. Are we at a point locally where the system itself is overwhelmed, or have we had to adjust now where we're at least caught up to the point where we're able to help some of these children?
I think there are a lot of people out there who are doing the best that they can to help these kids. Like Jeff was saying, we've got the mobile response team. A lot of the schools have more resources than have been available. The hospital is definitely here for them as well, and we definitely try our best to take care of them, in all capability that we can.
And to the point that I think that was made is not that parents don't want to be good parents. I think parents want to be good parents. But if you tell a parent that their child has some appendicitis, there's no issue. They're going to get them to the doctor. They're going to get them taken care of immediately. You tell a parent your child is dealing with depression or anxiety, sometimes there's a kickback to it. Well, they're just being kids. They'll get through it. There's still the big stigma surrounding mental illness. And that's a big barrier for a lot of the recovery efforts and teams that are trying to help teenagers to work through these issues.
We got a question that came in from from one of our parents, John Brady, on Facebook. Says, where do you draw the fine line between school involvement and responsibility of parents? Being an involved parent, I have seen teacher involvement that has not been positive in nature. Well, that's kind of an interesting take on this. But there is a lot of circumstances where the school is seeing the problems and the parents aren't. I mean, what sort of advice do you give to parents to find out what's going on with their child?
I don't, and some folks may disagree with this. I don't know there's such a thing as being an over-involved parent per se. I think any parent has that responsibility to make sure that their child is getting his or her needs met, whatever those needs may be. If they're having issues in school, but their parents aren't seeing them at home, sitting down and working with the school team and saying, tell me exactly what you're seeing. Let's work out a plan to address this. I'm certain that the school is going to be responsive to that parent and because they don't want a child that's struggling, because a child that is struggling and is disruptive is not just disruptive to that one child, they're disruptive to every other kid in the classroom. I think they want to work collectively to see what they can do to help them to resolve any issues that are coming along.
And I think a lot of the behaviors that parents are going to see at home can kind of be passed off as typical teenage behavior. Mm-hmm. A lot of teenagers want to isolate and be in their room instead of being around their family. Well, that can be seen as just typical teenage behavior, but in general, it's also, a big sign of depression. You isolate yourself, you pull yourself away from people, and it can be just opening up that conversation. We all experience anxiety, and unless you communicate and talk to the teenager, then you're not going to know the level that they're experiencing it at.
I think some parents that I've talked with through the years of doing therapy with kids, well, if my child's got a problem, they know they can come to me. That's not always a good response because, again, oftentimes the adolescents or children, they don't know what they're dealing with themselves, much less going to somebody and talking about it. They're going to go to their friends first because that's what teenagers and kids do. So to assume that my child's not saying anything to me is to assume there's nothing wrong. I think we have to challenge that notion at some points and be involved in having those conversations, doing check-ins with your kids, seeing how they're doing.
You just made an interesting point, Jeff, that when kids are having problems, they go to their friends and talk to them about their problems. Do you find that kids just decide that they're embarrassed by this issue that they're having and they just don't say anything to anybody? Is that the reason why, or do they just not recognize that they are struggling? I mean, what's the issue there? You would think if somebody's having a problem, they would step up and say, hey, I think I'm having a problem, but that's not always the case, is it?
I think sometimes it is easier to go and talk to your friends because sometimes your friends are dealing with some of the same situations that you are. And in talking with your parents, it can be scary saying, hey, this is what I'm dealing with right now. Because sometimes as kids, we automatically think that our parents didn't go through stuff like that. That's some of the stuff that I hear pretty regularly is parents explaining to the kids once they've been given the opportunity to is, I understand what you're going through, but sometimes in the heat of the moment, you don't necessarily understand or see those things.
And oftentimes, and it's no fault of parents, they're busy. They're trying to live their lives, trying to make and provide for their children. Sometimes part of the issue is conflict between the parent and the child. And then you couple in everything else with the school pressures, with social stressors that are out there right now. It can be difficult for a child, adolescent, whatever, to go to their family member and say, hey, this is what's going on. Doesn't mean parents are bad parents. It just means that it's easier for kids to go to their friends. There's just more connection with them. And socially, we know that's what kids do. They start associating with their friends and identifying with their friends far more than they do family. That's just part of natural development. Unfortunately, some of the things that we see in our hospital is kids getting some really negative advice and really negative instruction from their peers on how they should cope with things, and it's shocking what we hear.
Let's go ahead and if we can, take a look at part 2 of Thomas's special report that he did last night. He actually interviewed one of the young students here from our school system who talks a little bit about some of the problems he is having. And when we finish with that story, I'd like to talk to you all a little bit more about some of the things that children are dealing with in the school system, and also not only that, but home. That's something we haven't really talked about. Let's go ahead and take a look at that.
Past 4 years have been the worst 4 years of my life.
Like many students throughout Bay District schools, 15-year-old Clayton Renau suffers from depression. Some students have trauma from Hurricane Michael and COVID-19. Others are worried about family financial struggles. Renau is grieving after his parents divorced. School social workers say students react differently to the traumas.
These behaviors and traumas manifest in many different ways. It can be temper tantrums, for example. Younger students really struggle with.
Renau says he shuts down and refuses to talk to anyone.
A couple weeks ago, I just quit doing schoolwork. I stopped. I was doing the bare minimum.
Renau says he stopped hanging out with friends and began eating lunch by himself. Some days he doesn't talk to a single person. He says depression doesn't just affect his social interaction. Until recently, he predominantly ate fast food because he didn't care about anything, including his diet.
I have high cholesterol and high sodium and all that. And my diet, a couple times whenever I went to the doctor, I've had high blood sugars and all that. So I just stopped caring.
Recently, doctors and school counselors have worked with Renau on coping with his depression. If he had waited much longer, there may have been deadly consequences.
I need to start taking care of myself again, or I could have a heart attack at the age of 15.
Bay District schools refer students to mental health teams. All 9th graders receive training to raise awareness of depression. Other students have different issues stemming from depression and anxiety.
Symptoms of anxiety or depression, most of the common things that we see are things like sleep disturbance, appetite disturbance, disturbance with their energy level, concentration, memory, those kind of things that really interfere with a child's ability to learn.
The district has school counselors that work with students. Each school has at least one social worker on staff, and there are 40 clinical staff workers employed throughout the district. Guidance counselors meet with students and can recommend therapy. In fact, the school system now has more licensed clinicians, social workers, family therapists, and health workers than ever before.
We provide just a tremendous amount of non-clinical services for students, everything from social skills individually, in groups.
Chisholm says students meet with support staff throughout the school day during non-core classes for therapy sessions. Despite all these staffing increases, Superintendent Bill Husfeld says there are more mental health issues than ever before.
Sometimes parents are in denial. Sometimes parents don't want us to tell them that their child needs counseling.
Since he began working with Rosenwald counselors, Renau says he cut down on fast food. His depression still comes in waves, but he's hopeful that the next 3 years at Rosenwald will help him deal with the grieving process.
Before I came here, I never wanted to go to school. I've always hated it. But I came here and I have 4 teachers. Every last one of them teachers help me every single day to get better.
But the process is never ending for school administration, and the need is continually growing. In Bay County, Thomas Schultz, News 13, Panhandle Strong.
Okay, that young man, by the way, was very brave to stand up and talk about his issues because I'm sure when he gets back to school, there will be some kids who will make fun of him for that, which is a shame because, again, he is stepping forward and talking about his issues. But is that common, the kind of things that he is facing and he's seeing, is that common for what y'all see in your practices?
I think it's very common for what we see. You know, a lot of, like I said, isolation is one of the big signs of it, the lack of energy, not wanting to do anything. You get to the point to where you just really don't care what you're doing to yourself because you don't have the desire to do a whole lot of anything, let alone take care of yourself.
Right.
He brought up that he's laying off fast food. What does his diet, what do eating habits have to do for kids that would affect their mental health?
I am a big firm believer that, you know, what we put in our body has a lot to do with what kind of is going along with our head. When we eat healthy, when we're active, when we're doing all of those things, it just, you know, it helps us take care of ourselves, which encourages us to feel better. We all know fast food is not the most healthy food out there, and, you know, it's not necessarily what we need to be putting in our body. And you know, it's going to make us more sluggish. It's going to, you know, increase the cholesterol and put weight on us. And, you know, all of those things kind of add to what are going to make us even more depressed, too.
All right.
We had a comment come in, said, let's see, in my opinion, I need to go back to eating dinner at the dinner table every night. Will resolve some of the issues. Parents have to be involved. That's great, but in some cases, there is only one parent who is working at nights or working two jobs to take care of these kids. In some cases, the economy and inflation, the things that we're experiencing in our economy right now, there may not be food on the table for a dinner table. How big of a problem is home life for these kids? We talk about school and how they can help at school and bullying, things like that, all the effects school has. But I guess most of this does start at home, doesn't it?
It does, and that's the perception. It's I have to spend all this time and do all these activities with my kids, and I think it's not so much quantity as it isn't as much quality with your children. Just spending that time. I mean, everybody's got to get up in the morning and get ready. You may say we're all running around all over the house trying to get ready and stuff. Checking in, just seeing how people are doing. Spending that time, if you're driving them to school, spending that time driving to school instead of having everybody's face down into their phones and in their earbuds and not paying attention to one another. Spending whatever time that you can together, making the most of the few moments that you get before the 500 other distractions of life that come along and pull you apart as a family. I think, again, it goes back to making it the priority and recognizing that be it your children, be it your spouse, be it whomever, if we don't make time for the other people in our lives, I think there's going to be consequences that we have to deal with.
I agree with that.
How much are you seeing, especially in the last year or so since the economy has started to become more of a stress on families, how much are you seeing kids coming in saying, that's one of my problems, that's what I'm worried about, is whether, you know, my mom and dad, my little brother, my little sister, whether we're going to get food from day to day? Is that truly a real factor for a lot of people, or just a very small amount of people? I mean, what are you seeing?
I think home life stressors are definitely things that, you know, the kids are dealing with, and it is hard on them. I mean, we've got some that come in that are already working, and, you know, they're trying to help encourage and support their family the best way that they can, and that's a lot of stress on them too, and it does make it really hard for them.
Yeah, I don't know if kids come in and say, I'm suicidal because we don't have groceries. I think what we turn into and see instead is they're dealing with depression because everybody else is trying to just keep the family afloat, as you said, so it's more of a direct cause with indirect correlation. They're working to just keep the family going, and so as everybody's busy, like you said, time is a finite commodity. There is only so much time in a day. So how do you make the most of what you have with your family at that point? How do you let kids be kids and not to be parentalized and have to take care of adult responsibilities at 12 years old?
Let's get into the other thing that has lately, in the last, say, 10 years or so, has really become a hot button issue with a lot of kids and the mental stress they go through, which is social media, cell phones, things like that. Should parents obviously should be monitoring, but should they be maybe taking those factors out of a child's life? Should they keep the child off of social media? Should they keep the child completely away from a cell phone? I mean, it doesn't sound practical, but is it possible?
I think that it is important for kids to have some of those things because, it is important for them to have the ability to reach out to their friends or their family or whoever it is when they need that opportunity. The issue that I have with social media is that a lot of times it does show the highlight reel. We see people's lives as celebrities, all of those things, and their life looks wonderful and fantastic. And, they look beautiful because they've got all these filters and things of that nature. And it's hard for even adults to look at it and, sometimes think, why isn't my life like that? Why can't I be like that? Why am I going through so many difficult things, but look at how wonderful their life is, and it is hard for us to also think just, those are the reasons that they're posting those things. It's not because their life is great and wonderful. It's just because that's how they want to appear.
Right. And I think social media, cell phones, that's what we have now. So how do you teach somebody who is a teenager that, let's talk about balance. We could say take away their cell phones, shut down all their social media accounts. This may be a terrible example. They outlaw drinking and driving. People still drink and drive. So the point I'm making with that is, how do we teach kids there's balance in life, that what you see, as Brianna pointed out, these are filters. This is not reality. Reality is people are just their average every day. How do we get them so that their central focus, that their identity doesn't come from an artificially created celebrity, if you will, help them to identify with who they are and finding their own selves in it.
The celebrity phenomena, the filters and things that you were speaking of, Brianna, it's nothing new. I mean, you go back to the magazines in the 40s and 50s, and they had a housewife dressed to the nines pushing a vacuum cleaner. Now, how real was that? I mean, you had TV commercials with people looking beautiful and glamorous. That's been going on for decades, ever since advertising and mass media was a thing. So what's different now?
I think it's that cell phones allow us that instant gratification. We have it at our fingertips at all point in times, no matter what. Normally, for any of us, our cell phone is attached at our hip or in our bag or whatever. It's easily accessible for us to have right then and there when we need it. At a push of a button, we can pull up social media. At the push of a button, we can make phone calls or texts, or a lot of kids now, they're getting the bullying constantly through social media and cell phones and all of that stuff, so that instant access, that instant gratification is what's making it a lot more difficult because, even before, you would have to turn on the TV. You would have to be there at the present time to be able to do that, whereas now it's just the constant access to it.
It's constant access to anything and everything, and I mean anything and everything. Well, we have had notices where there are different, I won't say the social media, but certain challenges that are posted where who can collect the most non-skid socks from a psychiatric inpatient hospital. There was the shampoo challenge where once I ran out of my shampoo, I was going to kill myself. These are things that get posted and have followings. So you don't just say, I'm going to shut this part down. You look at what is it that all behavior has a purpose. What behavior is what purpose is being met by this behavior, by either the person posting it, or why would we choose to follow something like that? How does it sound like a good idea that I want to get as many pairs of non-skid socks from a psychiatric hospital to win the challenge? Things that, again, when we were younger, we had different challenges. My parents had different challenges. Parents today have different challenges. And the kids today, when they become parents, they'll have different challenges. But it goes back to the basis of what are we doing what are we teaching as far as in family values? How open are we to accepting the fact that mental illness is a real thing for kids? It's not just physical illness that a parent would jump to take care of their child's needs immediately. That mental health is just as important, and I'd say in some cases a lot more important than physical, depending on what you're dealing with. If we can't address the body as a whole, you can't just deal with one part of it and expect it to work. We have to address it together.
You would think that at times school would be a relief, especially if the pressures on a child are coming from home, that school would be the release, the place, the refuge. School's out for the summer now, and a lot of times I'm thinking school is probably where the problems start. So what's the story here as we move into the summer? Are kids safer now that they're going to be home, or are they worse off because there's maybe not enough people around to notice problems?
I think it kind of goes both ways. Sometimes school can be a refuge, as well as home can be a refuge from stuff that's going on at school. If you're at home and you're dealing with bullying at school, at least that's a momentary break where you're not having to deal with that stuff. Whereas if you're dealing with stressors at home, sometimes school is the only place where you're getting fed your 3 meals a day, where, you're not having to deal with whatever is going on with your parents or your home life. And, I think either way, it's kind of a difficult situation and can be seen as difficulties.
Right. I mean, again, to Brianna's point, some kids' school is that refuge because they know they're going to at least get breakfast and lunch there 5 days a week. They know they're going to be relatively safe from a lot of things. They don't have to worry about being abused or anything along those lines. But on the converse side, you've got the kids that are going to be home all summer who are thankful to get away from their peers, their bullies at school. As Brianna pointed out, though, you have the social media, the 24/7 bullying. So I think we saw that during the pandemic when schools were shut down. It was kids were having to learn to adopt. I mean, kids function through their social networks, and to be cut off from that, what they were left with was reaching out however they could, trying to struggle to make it work, just as the parents did. They were trying to figure out how to suddenly have a child at home, and they've got to try to go to work, and they weren't planning for it, which creates a lot of stress all the way around.
Let's talk a little bit about some of the healthy activities that kids can maybe do during the summertime to alleviate some of these issues.
I think getting outside is just something that is really important, whether you're going out in your backyard. We got to get out of our room. We got to get at least some type of activity going on. Not everybody wants to go running. Not everybody likes the exercising, but at least if you go outside, there's a lot that can come from that. You're getting that vitamin D, and, that's something that's really important for us mentally and physically as well.
Well, and one thing, too, what I've talked with parents before is if school gets out May 30th, May 29th is not when you need to figure out what your child's going to do that summer. Work on some things. Plan with them early on, starting around spring break. Hey, let's start talking about what you want to do this summer. If you're old enough for a part-time job, are there learning opportunities? Are there things going on through the community or different programs in the community, boys and girls clubs, things along those lines? Like you said, finding those activities in the community that are supportive and positive, supervised and monitored, things that promote positive health, be it physical and mental health.
Let's talk a little bit about, we've talked quite a bit, in fact, about the warning signs, but let's talk a little bit about the resources available. What if a parent does notice that their child may be showing signs of some mental health issues? Where can they turn? What's available?
There, at least thankfully now, are becoming more and more, options for mental health. We have several places around the community that are very helpful for that, where they can go and see therapists. And at least now, luckily, it's not just where they have to go face-to-face. They can do teletherapy and everything like that, where, those can be lots of options to help them out with lots of different, however they need to get the help.
Yeah, there are, one thing, through Northwest Florida Health Network, through DCF, they've funded several initiatives in the area. There's the mobile response team. That's a 24-hour-a-day response for anyone, adult or child, that's having a mental health or substance use crisis. They can talk to you over the phone. They can do it via Zoom. They can come to your house. Several mental health centers in the area have specialty adolescent programs. Part of our step down from inpatient treatment, we have an intensive outpatient treatment program that's about 4 to 6 weeks for adolescents. We treat that as a good step down, but as having a crisis, they can be brought to our hospital. We can evaluate them. There's Life Management Center, there's Florida Therapy, there are several others within the area. Oftentimes law enforcement is a good resource too, because they can connect that person with the mobile response team if they can't get to it themselves. Pastors, chaplains at churches, synagogues, places of worship. I think there are a lot of places in the area where people can reach out. It's getting past the barrier of one recognizing, okay, I need to do something now, and then actually doing it.
Is there anything a parent can do, any technique or anything they can do themselves if they see that their child is maybe feeling anxious or overwhelmed?
I think just talking to your kid is the biggest thing, asking them if they need somebody to talk to, asking them if they need help. I think just making sure that, you are active and part of their lives, because sometimes that's all anybody needs is just the opportunity to say, do you need help? Because it's hard for any of us to say, I've got something going on, I need this, but actually having somebody ask is, a really big step.
And it's about creating that environment where the child feels comfortable and safe talking to you. If you and your child don't spend a lot of time talking together, I don't think you can really act surprised that they're going to not come to you and talk to you. Again, it's not a matter of quantity, but it's quality. How much time are you spending just in that 5-10 minutes a day, just at one-on-one, putting down the phones, turning off the TV, and just sitting there just checking in with each other, seeing how things are going, creating that environment where that child's going to feel comfortable coming to you to say, hey, I'm struggling.
I hate to delve into this deeper into the pool here, but when you have a child that is contemplating suicide or has really reached the end of their mental rope, if you will, what do you say to those people to pull them back off the ledge and bring them back to reality and try and bring them back into the fold?
That's like asking how many colors of red are there. Everybody is completely different. I think the first thing we always want to try to do is make sure that person is safe, first and foremost, whatever that looks like. Do people say things and they don't mean it? Sometimes. And a lot of times people will write it off, oh, they're just saying that all the time. They don't really mean it. That doesn't mean we should ignore it. I think, again, it goes back to sitting down one-on-one, and we do evaluations on an emergency basis at the hospital, and it's a matter of just assessing what's going on. Just because a person is placed under a Baker Act does not mean they're going to be admitted. It means they need to have an evaluation with a psychiatrist or psychologist. So the first step we're going to do is do that evaluation with them. They're going to see a professional if they're there on a Baker Act. If they just walk in and say, hey, I think my child needs to be evaluated, we're certainly going to evaluate them and work with the parent and see what's going to be the best thing for that child at that moment.
Is it a little too Pollyanna or of an attitude to think that you can explain to a younger person that, hey, I know it looks really bad right now, but life gets better down the road? Are they able to accept that and maybe take that as good advice and move on, or is it something that they can't see?
I think in the heat of the moment, sometimes it's really hard to just see that, especially when you are stuck in that mindset of, everything is terrible and bad and really hard right now. So I think, sitting down and actually talking to them and kind of learning more about the situation is sometimes the best bet and the biggest way to help them. So then you can encourage them to see, okay, so this is terrible bad right now. Can you tell me some other things that are going on? Maybe some of the good things that are happening, because when we can focus on the positive things, it kind of gives us a different outlook. And I think sometimes just talking to somebody to get a different perspective can be something that is really useful.
Yeah, and the thing with children and adolescents, they tend to be very concrete and short-sighted. If something is bad, everything is bad. They tend to speak in absolutes. So sometimes, like Brianna pointed out, it's let's break this down. Not everything is bad. What you're going through right now, yeah, it's pretty bad right now for you. Let's talk about what you've got going well. And the times I guess we look at is when those kids really look at you and say, I can't tell you one thing, and they're sincere about it. That's troubling. Because for some kids that is the legitimate truth. They can't find you one positive thing going on right now. So we do kind of work very concretely, very short time frames. We don't drag it out. You got to deal with it here and now with them.
I'm assuming, again, my assumption as a layman here, that communication is the key to all this. You've got to get the child engaged and talk to them.
It's a big part of it. If they don't talk, we can't see what's going on. I mean, we can see observations. We can make, assumptions based on observations. But until we really get them talking about things, and even then, sometimes they don't have the words to tell you what they're feeling or thinking. They're struggling with it themselves.
And that's one of the things that I tell them too, is I say, if you don't talk to me and you can't tell me what's going on, I can't really help you. I can't do anything about it because I don't really know what's going on. I can sit here and I can assume, and like Jeff said, we can observe and watch and see what's going on all day long, but unless you actually sit down and talk to me, or at least try to talk to me, then I can't help. So it is that communication factor of, I need to know what's going on. You need to at least give me brief descriptions or something, whatever it is, so then that way we can talk through things, we can work through things.
I'm also assuming that, again, assumption on my part, but that most kids think that this is only happening to them and that they don't realize there are other people, their same peers, who are struggling with the same type of things. Is that fair to say?
I would agree with that. And at the hospital, we do a lot of group work, and we tend to keep them kind of in the bigger groups as much as possible, because when you sit down with people that are your age, it is easier to open up sometimes and talk about what's going on. And then they do get the opportunity to see that I'm not alone in this. I'm not the only one that is struggling, even with similar situations. So then it does make them more comfortable and kind of open their eyes to see that it isn't just me that's going through this.
Are there any closing things or comments that we haven't discussed that you really feel is important to get out in this session? Anything you'd like to add?
I mean, I would just, encourage parents to sit down with your kids is not as much as possible, but, just make sure that you are active and doing, we all do what we can. We all do our best anyways, but, just try to make that effort to give your kid the opportunity to talk to you. Show them that you do want to be part of their life, because sometimes they do have a lot that's going on. And, even as parents, we can't just assume that everything is okay, because sometimes it's not. Even when we try to, show that mask that everything is all right, it's just a mask.
Yeah, being a parent's got to be the toughest job in the world. I think every parent out there, no matter what the outside sees of them, I think every parent deep down is trying to do the best they can sometimes with what they got. So to sit back and say you should do this, and this doesn't apply to every situation, but I think, again, it goes back to that engagement that we've talked about. It's not about what you can buy your kid or give your kid. It's a matter of how much of yourself are you willing to spend with your child to show them that they're what's important, that their situation, that life is, sometimes life is it's gonna be rough. But what do we fall back on? What are we teaching the kids in our communities? What are we teaching our children in our homes? That when things come up, because as adults, you turn 18, the problems don't stop. They just change. So what are we teaching them about coping and becoming healthy coping adults? And we're going to make mistakes along the way, and that's okay. That's what people do. We're human. But it's a matter of, are we willing to stay engaged and to make sure that our kids understand that they're the priority for us?
Well, you're right. Parenting is a tough job, and parents do not have all the answers. And as soon as parents realize they don't have the answers and know that there's places they can turn to call or to request help, I think the better off everybody's going to be. I would say that understanding that there are places to turn to would be the biggest takeaway from this, I think, for parents and for kids. If you think you're having a problem, please just speak up. Help ask for help. Try to express yourself to either a parent, a teacher, a peer, anyone, and let people know how you're feeling and that you may be having a problem. Is that fair to say?
Yeah, that's perfectly it. In the world of Zoom technology and everything, there are several therapists that's all they do is via Zoom. So you don't have to pick up and go all the way across town to see somebody. There are different avenues for people to seek that help that they need.
Help is available. You just got to ask for it. Jeff, Brianna, thank you both so much for participating and taking time out of your afternoon to be with us here today. I'm hoping that we helped a lot of folks with this. Jeff Stone and Brianna Villalobos with Emerald Coast Behavioural Hospital. That's, unless y'all have anything else, that's going to do it for us. Hey, we appreciate y'all tuning in here on this 13 Now segment here, and stay tuned. We're bringing you these type of things all the time. Appreciate you joining us.
Thank you.
Thanks.